In the previous videos, we talked a lot about logical aspects of making the choice to integrate E4D into our practices. Things like marginal integrity, aesthetics, clinical outcomes, profitability are all very important to us. But let's shift gears for a moment and think from the patient's perspective. The patient's thinking about emotional issues. They're thinking about things like, will the procedure hurt? How long will it take? What will it cost? And how long will it last? Now, I stated at the beginning of this series that I've been practicing CAD/CAM dentistry for 18 years, and that means that I've literally treated thousands of patients using the CAD/CAM method. And to this day, it still amazes me how positive the patient response is. So if we focus on their questions and we compare the answers to those questions for the traditional 2-visit laboratory fabricated crown versus the E4D crown, we can see a dramatic difference in the patient's emotional response. First question, will it hurt? Well, whenever we bring the procedure down to 1 visit as opposed to 2 visits, we eliminate many of the discomfort factors associated with that second visit. We eliminate the discomfort of a temporary, the discomfort of a second anesthesia event, and the discomfort of just having to go through a dental procedure again. So in a very real sense, we're significantly reducing discomfort whenever we use E4D in a single visit procedure. Next question, what will it cost? Well, we may choose to charge the same procedural fee to the patient, but we are reducing cost to the patient overall using E4D in a single visit versus a 2-visit laboratory fabricated crown, because the patient does not have to incur the cost of missing work a second time. And believe you me, in this economy, that's important. Patients do not want to have to go back to their bosses and ask for another day off. They don't want to have to deal with the stress of having to miss work, and of course the lost wages that result. Patients also ask the question, well, how long is it going to last? There have been study after study after study that demonstrate the fact that bonded ceramic CAD/CAM restorations have at least the same longevity as that of a gold crown, which in essence has always been the gold standard in dentistry. And so we're providing restorations that are very, very durable and also beautiful, as we've seen in these other videos. You know, there's something magical that happens whenever I'm able to tell a patient that I'm going to be able to fix your tooth today in 1 visit using a beautiful ceramic restoration. And in so doing, I involve the patient with the process. I explain to them that I'm going to first prepare the tooth, then I'm going to scan it, and then together we're going to take a look at the design, and then you're going to take the block of porcelain and you're going to place it in the milling unit. And when that time comes, I allow them to do that, and as they do so, they begin to watch the milling process and they stand there in awe. They're just amazed by the technology and the precision. And then at the end of the visit, they look at me and they say, are we done? And I say, yeah, we're done. You can go and do whatever it is you'd like to do. You do not have to come back for another visit. You can chew on this tooth immediately. And I really appreciate you being my patient, and I'd really appreciate it if you would tell your friends and family. And they're thrilled to do so because they know they're in the right place and they appreciate the service that was provided for them. By now I know you're curious and you want to know what the next steps are. Well, quite simply, all you need to do is fill out the survey that's available on this website and then go to the next step, which is to consider a custom ROI for your practice, to go to a preview in Dallas, to gain more information so that you can make an informed decision as to how to integrate E4D into your practice.